Hi, my name is Leah. I'm a pharmacy technician for Nottinghamshire Healthcare. On a day-to-day basis, my job is very varied as I travel across different sites. Walls Road being my main base, I also cover Millbrook, Highbury and Lingsbar. I label and dispense medication, check prescriptions, carry out medicines reconciliation, I visit wards and I talk to patients, and I carry out CD audits. I order stock and troubleshoot stock problems where needed, in particular for like TTOs when there isn't enough stock to fulfil the order, and I do some general housekeeping. The entry requirements for my job is an NVQ and BTEC level 3 in pharmaceutical services, and you must also be registered with the GPHC, the General Pharmaceutical Council. My journey from school to pharmacy was quite a different one. So at school I was adamant I wanted to be a nurse. I inquired about joining the British Army, to which I was successful. And here I was supposed to initially join the Queen's Alexandra's Royal Army Nursing Corps. But upon passing my selection, my personality was more suited to the combat medical technician role. In basic terms, this role is like a frontline paramedic. Whilst training as a combat medical technician, part of my course included pharmacy training and exams. I then learned of my medical discharge from the army as I had sustained an injury during my basic training, and as I enjoyed the pharmacy aspect of my training, I sat down with the army officer who had taught the pharmacy classes alongside a civilian pharmacist to discuss my options. I then searched the NHS Jobs website for pharmacy jobs in Nottingham and came across one at the Wells Road Centre. Upon successful application and interview, albeit a temporary position, I remained here for 10 months. After this, I decided to put my skills to the test and pursue my nurse training again. I obtained a job as a healthcare assistant on a chemotherapy unit at the Winchester Hospital. Whilst here, I had a lot of interaction with pharmacy collecting chemotherapy treatment and medication. It made me realise how much I actually missed pharmacy. Again, I searched the NHS Jobs site and found a bank position had come up at the Wells Road Centre. Again, bonus. After successful application and interview again, I was a member of the pharmacy team and I'm still here to this day, almost 12 years later. Some of the main skills and characteristics required for my job as a technician are: you are required to be confident, reliable, professional and safe. You also need to have good communication skills, especially when talking to patients and other members of staff across all levels. You also need to have good time management and organisational skills, particularly when ward-based, as you can be working alone but have dispensary duties that afternoon you need to get back for. It is also important to have leadership skills and independency, as you may occasionally have to work alone. When I first qualified in 2017, I became a Band 4 technician. After gaining experience at this level, I then progressed onto a Band 5 medicines management technician. You can also, as a registered technician, move into roles with the CCG, prisons, management, etc. And some registered technicians choose to specialise in certain areas. I myself chose to specialise in mental health pharmacy. Whilst working at Wells Road, not only have I gained my NVQ BTEC level 3 in pharmaceutical services, I was also supported through my NVQ and BTEC level 2 in pharmaceutical services. The best part of my job is going on to wards. I enjoy seeing and communicating with patients and staff members. When you have a particular ward or a few wards for a long period of time, you really get to know the staff and you see the patients coming through. I also feel a great sense of achievement when you're able to witness a patient ready to be discharged, knowing that you've had an input into their care. If I could describe my job in one word, it would be challenging. And also some of my favourite things about Nottinghamshire are the different parks to enjoy walks around. Woollerton Park, for example, Clumber Park, Rufford Park, just to name a few, all within a short distance of drive from the city centre. I also enjoy the social life and the variety of cafes and restaurants there are.